Welcome to SA News Weekly News Update. We'll cover the top stories from across the United States, important developments worldwide, and new insights from the world of health and science.
SpaceX entered public markets this week in one of the most closely watched financial events in modern U.S. business history. Reuters reported that the company priced its initial public offering at $135 per share, raising $75 billion and valuing the rocket, satellite, and space technology company at about $1.77 trillion at pricing. On its first day of trading, shares opened above the IPO price and pushed the company's market value past the $2 trillion level, making SpaceX one of the most valuable publicly traded companies in the United States. SpaceX is deeply connected to U.S. space infrastructure, private launch services, Starlink satellite internet, NASA missions, and the broader commercial space economy. The IPO broke previous records and drew heavy market attention, including from retail investors. SpaceX is viewed by supporters as a company with rare strategic importance, but the valuation depends on future growth in businesses that are expensive, technically risky, and highly regulated. The company's future will likely depend on launch cadence, Starship development, Starlink revenue, government contracts, and whether its space ambitions can translate into reliable long-term earnings. The Trump administration warned more than 500 hospitals that they are failing to provide basic price information to the public. The warnings are part of a broader enforcement push around hospital price transparency rules, which are intended to help patients, employers, and insurers understand the cost of medical services before bills arrive. Patients often do not know in advance what they may pay for blood work, imaging, surgery, emergency treatment, or routine procedures. When prices are hidden or difficult to compare, people may face unexpected medical bills, and employers or insurers may also pay more than necessary. The hospitals receiving letters may face penalties as high as $2 million annually if they fail to create plans to post clear pricing data. This is one of the biggest concerns in American healthcare, as it connects directly to affordability. Price transparency does not automatically make healthcare cheaper, but it can give patients and payers more information. It may also pressure hospitals to explain differences in pricing, especially when the same service costs very different amounts, depending on facility, insurer, or location. A powerful 7.8 magnitude earthquake struck off the southern Philippines near Mindanao this week, causing major damage, deaths, injuries, and large-scale displacement. The initial report claims that the quake killed at least 37 people, injured nearly 500, and displaced more than 32,000 people. The earthquake hit near Sarangani province and affected areas including General Santos. Buildings collapsed or were damaged, homes were destroyed, airports and schools were disrupted, and many residents moved into emergency shelters because of aftershocks. The hospitals were forced to operate in makeshift tents in some areas, while rescue crews searched damaged buildings and officials worked to restore electricity and water. One detail that stood out was the role of preparedness. The disaster drills may have prevented a higher death toll, especially in schools. The earthquake struck as students were beginning the school day in some places, but training helped prevent stampedes and allowed children and teachers to respond more orderly under frightening conditions. This disaster is also a reminder of the Philippines' exposure to natural hazards. The country sits along the Pacific Ring of Fire, making it vulnerable to earthquakes and volcanic activity. Even when disaster training works, building quality, evacuation planning, emergency shelters, and rapid relief remain essential. The CDC's June 12th update shows that measles remains a serious public health issue in the United States in 2026. As of June 11th, the CDC reported 2,073 confirmed measles cases in the U.S. for the year. The agency said 93% of confirmed cases were outbreak-associated, and 30 new outbreaks had been reported in 2026. The numbers are notable because the United States declared measles eliminated in 2000, meaning the disease was no longer continuously spreading inside the country. Elimination does not mean zero cases forever. Imported cases can still happen. But large outbreaks can occur when measles reaches communities with lower vaccination coverage or gaps in immunity. CDC says states and local health departments lead investigations and report confirmed cases to the national system. Measles is highly contagious. It can spread through air and linger after an infected person leaves a room. For many people, it causes fever, cough, rash, and discomfort. But complications can be serious, especially for young children, pregnant people, and people with weakened immune systems. Hospitalizations and deaths are possible, which is why public health agencies track outbreaks closely. The CDC's latest report also shows that measles is not limited to one state or region. Confirmed cases have been reported across many jurisdictions, including Texas, California, Florida, New York City, New York State, Pennsylvania, Washington, and others. At a time when healthcare affordability, lifestyle-related diseases, addiction, family stress, and social instability continue to affect communities, the spiritual teachings of Sant Rampalji Maharaj are being discussed by his followers as a model of preventive social reform. In recent public affairs, healthcare costs have again become a major concern. Many families worry not only about illness, but also about the financial burden that follows medical treatment. At the same time, tobacco, alcohol, and other harmful habits contribute to serious long-term illness, lost productivity, family distress, and avoidable suffering. Against this background, Sant Rampalji Maharaj's spiritual discipline places strong emphasis on living a pure, simple, and controlled life. His followers are taught to stay away from alcohol, tobacco, drugs, gambling, corruption, dowry, meat consumption, and immoral conduct. The message is not presented only as a religious rule, but also as a practical way to protect the body, family, society, and future generations. According to his devotees, initiation into his spiritual path comes with strict commitments. A follower is expected to avoid intoxication completely, maintain honesty in personal and professional life, respect all human beings equally, avoid unnecessary social show, and live with devotion to God. These rules are seen by followers as a framework that brings discipline into daily life. Sant Rampalji Maharaj's movement also highlights social practices, such as simple marriages without dowry and community service through free food distribution. These initiatives are presented by his followers as examples of spirituality being applied beyond prayer into real social life.
And that wraps up this week's bulletin. Thank you for joining SA News, and we'll see you next week. Truth that you want to know.